Hi everyone, my name is Mariana Rocha. I am a graduate student at Emory University studying to become a neuroscientist. Today I'm going to be talking to you about changes in PTSD over the course of pregnancy and how these changes might impact Black maternal health. First off, I'd like to start with the background knowledge that Black pregnant persons experience higher rates of PTSD. As you can see here on the right, they experience much higher rates of both current and lifetime PTSD as compared to the general population. Accompanied by this, Black pregnant persons are also at higher risk for pregnancy-related morbidity and mortality, and post-traumatic stress disorder is actually associated with these outcomes. Specifically, PTSD is associated with hypertensive disorders of pregnancy, such as preeclampsia. It's also associated with gestational diabetes, low infant birth weight, impacts on infant cognition, and higher risk for postpartum depression. The purpose of the study then was to understand how pregnancy affects PTSD symptoms, which can help us improve care and reduce the risk of these associated health complications. In order to do this, we had the following three aims. First, I wanted to look at how PTSD symptoms changed over the course of pregnancy. Second, I wanted to look at whether specific trauma history, specifically having past sexual trauma, affect how PTSD changes over pregnancy. And third, we wanted to look at how progesterone, which is a pregnancy hormone, impacts PTSD symptoms across pregnancy. To do this, we collected PTSD symptoms once during each trimester of pregnancy, and we also collected progesterone levels once during each trimester of pregnancy. Additionally, we collected information about past sexual trauma at the participants' enrollment visit. To look at PTSD, we use the post-traumatic stress disorder checklist, which is validated in minoritized populations, such as the one in our study. To look at past sexual trauma, we use the traumatic events inventory, which is a self-report of lifetime trauma. And lastly, to look at progesterone, we use blood draws once during each trimester. Getting into our sample, for this study, we recruited a total of 238 Black pregnant persons with a mean age of around 27 years old. Of these, 46.2% had a history of sexual trauma, which is much higher to the 29% in the general sample of women. Additionally, 24.2% of our sample met for probable PTSD, which again is much higher to the 6 to 8% in the general sample of women. Within the sample, over half were unemployed, and almost 80% were on Medicaid for their insurer. Getting into our first name, we were really interested, like I said, in looking at just how pregnancy impacts PTSD. Previous literature looking at how PTSD symptoms change over pregnancy is limited, and the results are equivocal, with some studies saying that PTSD increases over pregnancy and others saying that it decreases. For our study specifically, we wanted to look at PTSD symptoms longitudinally in this at-risk sample. We found that PTSD symptoms generally decrease as pregnancy progressed. Without looking at any factors that might impact this change, we saw that overall, just the course of time and the progression of pregnancy leads to a decrease in PTSD symptoms. As I stated in our aims, our second aim was to look at how past sexual trauma impacts PTSD symptom trajectories. We specifically focused on sexual trauma because sexual trauma has the biggest PTSD burden, meaning that sexual trauma is associated with greater frequency and severity of PTSD symptoms when compared to other types of trauma. Additionally, survivors of sexual trauma face victim blaming and skepticism, which can make the recovery process even harder. Specifically within the context of pregnancy, pregnant people have to undergo pretty invasive medical exams, such as cervical exams that might trigger symptoms of re-experiencing. And lastly, some studies have found that for survivors of sexual trauma, pregnancy can be accompanied with a feeling of loss of bodily autonomy, especially when they don't have a say in who provides their care. For example, having a male provider if their aggressor was also a male. For this reason, we hypothesized that sexual trauma would be associated with greater starting PTSD symptoms and that it would also be associated with an increase in PTSD symptoms over the course of pregnancy. What we found was that, yes, past sexual trauma was associated with greater initial PTSD symptoms. However, it was also associated with a decrease in PTSD symptoms over the course of pregnancy. Specifically for people with average to high levels of past sexual trauma, as compared to the sample's mean sexual trauma, we saw a decrease in PTSD symptoms, whereas people who had low or no sexual trauma did not see a change in PTSD symptoms and maintained relatively low levels of PTSD. Lastly, for our third aim, we wanted to look at more of the biological side of pregnancy and how that might impact PTSD symptom trajectories. So within pregnancy, we looked at changes in progesterone. Progesterone is important because it's a hormone that increases from 1 to 3 fold over the course of pregnancy. Hormones specifically are chemicals made naturally in the body, which help regulate important functions. Progesterone specifically helps support fetal growth and prevents early labor, therefore helping maintain the pregnancy. Additionally, in terms of mental health, progesterone has been shown to have both antidepressant and anti-anxiety effects. For this reason, we hypothesized then that higher levels of progesterone would be associated with a greater increase in PTSD symptoms as pregnancy progressed. And that is exactly what we found. We found that progesterone was associated with a decrease in PTSD symptoms over the course of pregnancy. Specifically for people with average and high levels of progesterone, we see a decrease in PTSD symptoms as pregnancy progresses. Taking all of this information together, we found that pregnancy may naturally lower PTSD symptoms, possibly due to increases in progesterone. Additionally, for people with a history of sexual trauma, they start pregnancy with more severe PTSD symptoms, but see a decrease as pregnancy progresses. In terms of how this research might be used, first, for people in our sample, the pregnancy period is a time where they have increased touch with healthcare providers, which might provide their providers an opportunity to ask questions about past experiences with sexual trauma, therefore minimizing the risk for re-traumatization. Additionally, in terms of policy and programs, codifying mental health care and prenatal health care policies would allow for people who are on Medicaid, like the majority of our sample, to receive mental health care and therefore possibly reduce the incidence of associated physical health complications. Additionally, our studies support the notion that progesterone may be a treatment for post-traumatic stress disorder. And with that, I'd like to thank my lab, the Great Trauma Project, our participants, and the National Science Policy Network for allowing me to present today.